2 weeks ago, I had really a life and a mind-opening experience from the healthcare field that had hit home. One of my family members, 17-year-old healthy son, twins actually, both had their wisdom teeth taken out. Next morning, one of my twins woke up and he had a little swelling on the left side of his face. The orthodontist appropriately said it's probably just some post-operative swelling, shouldn't be a problem. Statistically, that was probably correct, and really put some ice on it and nothing else to do. Well, later that night, evidently the swelling got worse. He began to vomit, have severe fevers, and develop swelling that my ex-wife describes. All of a sudden it looked like his left eye was beginning to close. He couldn't breathe. Took him to the emergency room, which was appropriate, and they sat for several hours, she told me, before he could get seen. She says in the 4 hours that they were sitting, she could see his face rapidly closing down as far as edema and swelling, redness about his neck. The bottom line is that he almost underwent a respiratory arrest at that time, and he was seen finally and was admitted immediately to the hospital, put in the intensive care unit, and started on high-dose intravenous antibiotics, and the ENT specialist came out late to see him that night, was managed in the ICU, and a diagnosis of necrotizing fasciitis was made. Necrotizing fasciitis is a tremendous infection that it can occur anywhere in the body. Most of the time it occurs in the lower limbs, and if it occurs in the head and neck area, it is associated with mortality rates, that's death, as high as 30 to 40%, because the infection is so rapid that it can't be controlled. This turns into what's called gas gangrene, and it is a terrible, terrible infection. This is what my 17-year-old son was going through 48 hours after a wisdom tooth was taken out. An asymptomatic wisdom tooth with no infection. The ENT people on Sunday emergently took him to the operating room and made a very large incision upon his neck. This is one of the ways you try to control necrotizing fasciitis, to debride any tissue and any abscess. I was told that x-rays show no abscess, but they were compelled to have to go and explore this, which was appropriate. He had to go on a ventilator to protect his airway, and over the next 24 hours, it just continued to get worse. He required another intraoral operation. His blood pressure was low. He was developing sepsis. High-dose intravenous antibiotics were not controlling a local infection, a local sepsis that was occurring in the left side of his face, as I presume, because I was on my way there, that it was all within the cheek itself. My recommendation at that time, as a surgeon and having knowledge of this kind of a problem and also knowledge of wound care, I spoke to the physician and said, we need to get him some local therapy to help control this, and I strongly suggest that we use Microcyn or Dermicyn. Well, I have had a year's of experience with Dermicyn in use from head to toe on my patients, especially in limb salvage work. I don't see necrotizing fasciitis. Thank goodness most physicians don't see it commonly, but when it occurs, it is something that cannot be controlled. Well, the physicians there certainly didn't know what Dermicyn was. It was not on formulary, so I'm suggesting a life-saving maneuver on my son over the phone as I'm trying to get an emergency flight there. And they would love to have used it because they had no way of controlling it, but we were unable to. I made urgent calls to my office and actually had overnighted 4 gallons of Dermicyn that I have for my own personal use in my office, shipped to Orlando Hospital. It luckily arrived just a little bit before I did, and over the phone I'm instructing massive irrigation orally and externally. And the wound externally I don't think was the problem. It was all an intraoral sepsis. Very difficult to get to. They had left drains in the oral cavity, but there was an endotracheal tube there also. So in my mind's eye, there was a loculated necrotizing fasciitis in his oral cavity, that was going on. They were so uncomfortable with this, and it was progressing so rapidly, that the physician in Orlando made a very good decision, and that was to airmed my son to the University of Florida in Gainesville. I flew simultaneously to Gainesville. They irrigated my son, by my recommendations, on the way over and for the next 6 hours when he got there. So he had had exposure to the Dermicin now for about 12 hours by the time that I actually got there, and he arrived there and was observed by the ENT specialist at the University of Gainesville. A decision was made to continue this irrigation, and I irrigated it myself that night when I got there, and he was taken to the operating room there for the first time early in the morning the next day. So this is about 24 hours of irrigation with the Dermicin. My first visualization of my son didn't look as bad as I had thought. I saw pictures that my ex-wife had taken. So in that 12 hours in which I hadn't seen him, but the Dermicin had been used, it was already working. His infection was being controlled. He was feeling better. He was on a ventilator, though, appropriately so. And we continued those irrigations. The ENT specialist from Gainesville took him to the operating room to breathe things. And he came out of the operating room and he said, David, he said, amazingly, it didn't look that bad in there. I believe this stuff is working. Within the next 12 hours, the swelling was down. He was waking up from the sedation. The edema about the airway and the neck was being controlled. And also the redness, the erythema, the necrotizing fasciitis that was going on. There was not purulent drainage. Things were being cleaned up. So I actually have a picture of him that I can compare to. And what I can tell you is that at that point, what I saw was dramatically different than just 24 hours prior. And within 12 hours from that time, we made a decision to extubate him, get him off the ventilator, continue these irrigations. And so now, 24 hours after the irrigations, we were getting him off the ventilator, and 48 hours after the irrigations, both externally and intraorally, he's off the ventilator. He's sitting up, he's talking with us, and an amazing turnaround over that period of time. Over the next 48 hours, we did continue these irrigations. A wound vac was placed externally. The swelling had gone down dramatically. Vision, all of these things were back close to normal. The diameter, I would say, of the cheek itself had decreased down 50%. The inflammatory tissue, everything there, was starting to respond. We had control of the local sepsis. The necrotizing fasciitis had been stopped in its tracks. I just got off the phone with my son. He has a wound vac on right now. The wound is now 60% decreased. He's still in the hospital. This is now 9 days. He'll be discharged on Monday. So this was a eye-opening experience from me, not only medically, but also family-wise. And I have a son who is thankful.